Good evening to everyone. We shall wait some time. Let shall we start, ma'am?
Yes, start, I think, because people will keep joining and it's better to not waste time.
Okay. So not further wasting any time, we'll start the session for today. Good evening to all the viewers who have joined the webinar. I hope everyone is good and healthy and excited for the session of today. I am Dr. Aditi. I'll be the moderator for today. I welcome you all. Also, a special thanks to Mr. Manish Jain, sir, the director of DGen Publishers, and the team for providing the platform Homeopathic 360 to showcase talent. So the topic of discussion for today is homeopathic case taking, which will be the part one. Also through the session, if any query arises, please drop in the chat box. We'll be discussing those at the end with the doctor, with the speaker of today. Now, let me introduce to the speaker of the day, Dr. Sadaf ma'am. Hello ma'am.
Hi.
Hi, ma'am. Ma'am has completed a graduation in homeopathy in 2009, followed by which she has upgraded her skills working with internationally and nationally renowned homeopathic doctors. She has done her post-graduation in clinical research and psychology. She has also been training homeopathic doctors since 2011 and has been invited to various organizations for sharing her knowledge. She has also been working in the field of psychology and has been promoting healing and lifestyle workshops. She has been awarded Healer of the Young Generation in 2015 by the Navbharat Times. Okay, so now without wasting any time, I hand over the session to you, ma'am.
Thank you, Aditi.
Welcome, ma'am.
Okay. So, Aditi, you'll be sharing the file, or shall I share my PowerPoint? How we are going to do with the slides?
Ma'am, you can share, ma'am, so you can easily means
The same share.
coordinate with what you are speaking.
Oh,
Same
oh.
slide.
So, good evening, everybody, and welcome one and all. Um, with regards to asking question and answers, so I don't want the session to be one way. I normally enjoy when it is both the ways. So I will request, but in order to maintain the audio, visual, etc., I'll request if I ask something in between. So we make maximum use of the chat box. Um, Aditi, my sound is not clear.
Ma'am, to me it's clear. It's clear to me.
Okay. So if at all there is any disturbance in the sound, just message me in the chat box. And yeah, so to begin with, if there is any doubt or any question, please put in the chat box and or in a Q&A questions. As and when I require participants to speak, I will request Aditi to unmute it. Mostly, I'll make sure that first I finish my presentation and then take over question and answer, so that we maintain the time flow and we don't lose the track of time. Okay. With this, let me begin my session. So today I'm dealing with a very important topic and a topic which is very close to me. Number one, because I enjoy doing this process. It's the most case taking is the most important process in homeopathy, and it really puts you in awe of how beautiful human mind and human body could be and how they can come together. So, and it's one of the most important process that is required in homeopathy. Often, another reason why this is a very close topic to me, because as I'm into teaching, many times students, they write to me, madam, I have a case of uterine colic, what do I do? Or I have a case of abdominal colic, what do we do? Or migraine, what do we do? So my plain answer to them is, please take the case and go ahead. But somewhere we are stuck between the idea of having protocols and idea of having some shortcuts to find remedy. Like very recently somebody asked me, so madam, can you tell me what is the protocol for cancer cases? And for them I replied, the only protocol that you have to follow is, number one, take the case, individualize the symptoms, then prescribe. You can take a numerous method. Today, with help of media, with help of social platforms and so many webinars happening, I don't think so there is anywhere a deficiency of knowledge. Knowledge is there everywhere. Every weekend you have someone or the other speaking, and there is an easy access to teachers now compared to when we were in our college and we passed out. So things are much easier, provided we are going to put in efforts, and this efforts means a lot. And in that, the major effort is finding the right remedy. Okay, finding the right remedy is very important, and that is not possible unless and until we take a very good case. Okay, so
Ma'am,
yeah.
ma'am, are you sharing the presentation?
यस, नहीं आ रहा है?
नहीं मैम, आ नहीं रहा है. मैं करूँ क्या शेयर फिर?
रुक रुको, मैं कर लेती हूँ. अभी आया?
हाँ, अब आ रहा है. अब आ रहा है.
ठीक है. So the foundation of homeopathic practice largely depends on the art of individualization. We all, as homeopaths, we know that a well taken case is key to your practice. Okay, nothing is possible if your case is not okay. You can learn predictive method, you can learn Segal's method, you can learn sensation method, you can learn keynotes method, you can learn with Dr. Sarkar, you can learn with anyone. But if you do not learn the skill of getting to the point, you will be lost. And that's the reason why I see many a time students are lost, because they don't want to put in the effort of individualization. Okay, so even if you have to read keynotes, and even if you want your practice to be based on keynotes, you need to have a well taken case. So what is most important? So what I've planned to do is, my plan of action with we had a word with Aditi, and I was like, I'll take everybody step by step into the examination of case of in cases. Okay, so I'll try my level best to correlate from the organon. Okay, forget the other authors and other teachers talking about, but going into the organon and then understanding how do you utilize those aphorisms in your practice is most important. So the individualizing examination of a case of a disease, in aphorism 83, Hahnemann writes, which I shall give in this place a general direction, of which the practitioner will bear in mind only what is applicable. So see how much he has given an emphasis on this. Only what is applicable for each individual case demands of physician nothing but freedom from prejudice, sound senses, attention in observing, and fidelity in tracing the picture. Okay, so he says that if you want to cure, there is no option from case taking. You cannot run away from case taking. Okay, if you are sitting with the protocol, you're already prejudiced. If you're sitting with formulas, you're already prejudiced. I don't say they don't work, they do work in many cases, but those are cases where there is lack of symptoms, okay, or it's an extreme condition. There is no way you have to give up on the fact of case taking. Okay, so case taking is the key to your success. Okay, how do you see this in your day to day practice? Today we are living in an era where we have multiple systems, predictive systems, sensation systems, this, that, etc., etc., cycle system, HHF, everybody, every doctor today is coming up with some or the other system. And this causes a lot of confusion instead of creating clarity amongst the students. So the whole thing is, instead of getting into the jargon, what I have learned, I have worked with teachers of all different methodologies and system, and what I have understood is they have done their best in their lifetime and they have found a path. We in our lifetime have to find out a path which best suits us and then apply it in our day-to-day life. I have worked with a long 11, 12 years with Dr. Rajan Shankaran and Dr. Sarkar, but I cannot do what they do. I come with my own individuality. So, how are you going to bring your individuality when you sit in your practice? That is more important. This aphorism, I really like it because it helps us with a lot of different things. The number one thing that Hahnemann writes is very important: attention and observing, sound senses, freedom from prejudice. So this thing should be very struck in your head. But how do I do it in my day-to-day practice? That's very important. Okay, there are more than one way to approach your case. Always remember, there's never a strict protocol. Okay, I remember, like, when you are in your college is set up and when you are just learning, you're given a protocol of case taking. Okay, chief complaint, location, sensation, concomitant, modality, then this. But what I personally saw in my practice is that there's more than one way. Sometimes the case taking is just chatting with the patient. Sometimes the case taking is different. Sometimes it's just tracing the pathology and understanding how the pathology has gone. So there are various routes and you have to decide how are you going to take your step in the case. Okay, this is very important. You learn different methodologies, but apply, think of how you can apply and when you can apply, or when you have to drop a certain methodology also. Case taking is not simply a process. You must remember, it's not just that you are asking, what is your name? My name is so and so. What age are you? My age is so and so. No, that's not. What is happening? My head is paining. No, this will not give you anything. I've seen practitioners saying, Arey, because she said like this, I think the rubric is this, and so the remedy is this. But that's wrong. Okay, it's not just a question and answer session. It's not an interview taken on an Instagram live or a celebrity interview on Coffee with Karan. Okay, it's an interview where you as a homeopath have to go through like a detective. It's more like a Sherlock Holmes kind of a thing, where you have to go with your binocular of all your knowledge and find subtle points. Sometimes you're asking a patient a question and patient replies B, and that becomes very important for you. The answer is not important then. Okay, like, let me give you an example. Just few days back, I asked a patient, tell me, how are you in making decisions in life? So she didn't say yes or no, but she started with something she took me into a very different topic in life. And there I understood that there is a lot of confusion in her head. She's not confident enough to speak. So that's how the patient will take you. Okay, they take you where they want to take you. Okay, but you as a person, you remember, in the psychotherapy there's a saying that as a therapist you are just a facilitator. So similarly, as a homeopath, when you're taking the case, you're just a facilitator. And always remember the rule: you listen, patient speaks. That's how you can make a very fine case taking. Okay, so observing every fine observation may not only be enough. Okay, she has a black mark over here, what are you going to do of it? The patient came into my cabin and she was wearing a very low necked or very short dress. That's not an observation. How are you going to, what are you going to do of this information? Oh, the patient, every time she was talking, she was putting hands in her head. What are you going to do with this information? You have to ask yourself this question. When I'm saying that I'm making this observation, okay, I want to understand, what does this observation means? How can I relate to it when I hear? Somebody gives me a piece of information, and then I have another piece of information. You need to see if the puzzles are fixing together, or is it just some very shattered piece, unimportant piece? That won't work. That won't help you in prescription. If you're gathering information which are very obsolete, you will just have information. I remember in Ken's lesser writing, he says sometimes you may have a book full of history, but yet there is no case. That's exactly what happens if you pick up things which makes no sense. The art of homeopathy is observing, listening, and then getting this information together. If you cannot get this together, there's a problem. How did the pathology develop? What is the pathology? What is your observation about the pathology, about the person, that you can relate with the pathology? Just for example, I'll give you, a few days back, I had a patient with extreme coryza, like stooping, like every time, and she was rubbing her nose and she was like completely irritated. Her eyes were all swollen up, and this rubbing, constantly rubbing. And then I saw her interaction with her kid. It was like, ah, ah, everything the child will do, even simple thing like very cute, mama, come to me, will be, go away. So now you understand this irritation in the pathology and the irritation in behavior, and they correlate to you. Why is the suffering there in this person, and how do I relate to what I am seeing in front of me? Okay, so all of these comes together. Okay, and when this information comes together, you can have an exact analysis in your treatment, and you'll be very sure about what you have to do with this information. Like, I'll give you, okay, let's move ahead. What are the important things you need to observe? You want to look for commonality between the disease and what patient says. Okay, so symptoms and system, how do you get them together? So patient before, how is the patient behaving before the consultation? Your case taken begins there. How did the patient behave before the consultation? How desperate was the patient? How did it come to you? And then you bring the jigsaw puzzle together when you're sitting in the case. I'll give you an example. Very recently, I had a case, and this is patient is my old patient, and there was a very let go kind of very attitude, like, okay, I want an appointment, and then he will take an appointment, not follow the appointment timing, and then he will cancel, and then he will come, and when he will come, he will take the medicine, then he's gone for 3-4 months. So I said, this is a pattern. Okay, this is a pattern. He's not able to keep up to his commitment. Okay, but I was not understanding why is this, what is happening with this guy. And when this person came for a retake, there were a lot of areas in his life where he wasn't able to commit, and the whole picture then came through, and we gave him XYZ remedy. Okay, now we are waiting for the follow up. But then the behavior during the appointments, or the behavior even before that, also gives you a slight hint. May not be in all cases. Okay, that doesn't mean that every case you have to be very observant about what is happening before the consultation. It doesn't mean that if the patient has not done something weird, it means you lost the case. No, but be attentive to it, understand what has happened. Okay, like for example, I had a patient few months back for an IBS treatment. He had multiple allergies. He had sleeplessness, anxiety, lot of symptoms. he was a regular patient of mine in my old clinic, and then I shifted him to another clinic. And every time, initially he used to directly interact with me, but then later I put him through a process where a receptionist gives an appointment, etc., etc. Now every time I will take his appointment or I will take his history, he'll be like, okay, okay, doctor, thank you, so sweet of you, doctor, God bless you. And he will be so nice to me. Okay, doctor, as you say, always his behavior will be like this. Okay. And I was like, wow, he's a very nice fellow, and I was giving him XYZ remedy, okay, with all his symptomatologies. Then one day I went to my clinic, and my receptionist said, "Oh God, this uncle, we cannot handle your this patient. Every time he speaks very loudly to us, this, that." And I couldn't believe what my receptionist was saying, because he was really very cool and calm and very sentimental in front of me in my case takings, in my interview. I said, "Fine, it's okay. Maybe there will be some misunderstanding. Um, we'll see later." So there was this time where he came to the clinic personally, and when it was his appointment time, I kept my door a little bit open so that I could see what's happening at the reception area. And what I saw was, it was very interesting to me that the interaction of his with the staff was very bad. But moment he entered into my cabin, he was all down to earth. So for me, this was an interesting symptom, and I gave him lycopodium on based on this: hard on inferiors, soft with superiors, and he improved a lot on this. Okay. Similarly, I remember a patient who called me, called at the reception, and there was an extreme panic created because the appointments were extremely full, and this patient was insisting that she wants to see the doctor as early as possible. And we all, and she was like also threatening that if y'all don't give me appointment, I'll call some political people, this, that. Lot of mess was created, and I said, okay, do one thing, I'll stay extra and I'll see this patient. And when I saw this patient, to my surprise, it was just a simple acne case without any underlying disease. But this talks about how desperate the person is. How is he viewing his pathology? Okay. And that gives you an important hint into the case. This can be an entry point into your case. This can be an anchor for your case. This can be an important observation that will then lead you to a different step in your case taking. So whatever happens even before consultation is very interesting, and we need to know that. Okay, coming back, also I remember once, when I was a resident with Dr. Sujit and Dr. Rajan Shankaran. So there was this patient when we were inaugurating the center. There was this patient who had uh, CA breast, and it was a huge tumor which was ulcerating, very painful condition. She had been to multiple homeopaths. She was a homeopath herself, and she had been to multiple homeopaths. And then she took an appointment and she came to us. And before coming to us, we give a case record form to the patient. Okay. So in that case record form, what we observed was, it was a blank form. What she did was, inside this blank page, she kept a ruled page. Okay. She drew lines with pencil. She first filled up everything with pencil very neatly. Okay. After she was done filling, she rewrote it with ink and rubbed all her mistake and made sure the page was as clean as possible. She presented a file which was perfectly arranged date wise, and a proper summary of all her treatment was given. So that again became an important indication for us as to what and who the patient is. And then the disease. Imagine with a coconut sized tumor that's bleeding, that's ulcerating, you're taking pains to do all this. Okay. So that becomes very important. So how is the behavior? What is the behavior? How has he come to you becomes the most important thing in your case taking. The next most important aspect of the case is, what is the pace of the person? What is the expression of the person? Is he oriented or is he disoriented? Now, when you go to meet a person, whether it is alert, whether he's dull, how is he answering? Is he answering in a very animated format? Is he very vivacious or is he very reserved? What is the mannerism? Is he sitting with respect in front of you, or is he behaving bad to you? I remember I had this one patient who came to my clinic, and there was a, so we have a chair over here, and then there's a table. He just kept his legs on the table and sat like this throughout. This was his posture. Throughout the case, he was sitting like this. So then the mannerism, it talks about who and how the person is perceiving. Okay. There was this patient who did a came for she was being treated for me under me for a long time, and she came for a follow up, and then you're laughing continuously. डॉक्टर आपकी दवा ले रहे हैं हम अभी तक ठीक नहीं हुआ it's pathological. You're talking about an illness and somebody is laughing while talking about his illness. It's interesting. That gives you an insight into there's something different that is needed. Okay, I again remember a patient, doctor, I want to meet you very urgently, take an appointment and do things with me. And no, I spoke about this case. Yeah, it was a 60-year-old female patient. She consulted me of uterine fibroids, hypertension, diabetes. Now, while she was speaking to me, she was very naive. She was talking like a child, not matured at all. She will she will use words like kids, like as if a small child is talking. डॉक्टर मेरे को ना पीपी में तकलीफ होती है, पुप्पू में तकलीफ होती है, will be easily frightened. Okay, very very childlike. Her whole, she was very fair, fat, and she was very childlike. She will giggle like a child. She will laugh and will get easily influenced by things around. Extremely scared with ghosts, dark, anything bad on television. So, understanding the patient's nature by her behavior in the consultation room, we gave her calcarea carb, along with obviously the other symptoms. Okay, but this is how you can start building the totality even when the patient is not speaking to you. Okay, similarly, there's another case I one visited for home. It was a home visit. When I entered the room, the patient was completely bedridden. It was a case of locomotor neuron disease, and this person was completely in the bed, not very much in conscious state, but there was a constant motion like this. Constantly, the patient was moving this, and I did neural examination, and it was very difficult for me to arouse him. And if you answer, you'll ask him anything, he'll just say yes or no and then go back to sleep. The orientation of the patient was not there. Okay, so this tells you what you have to do. Now, this expression and orientation of a person becomes very important, especially in deep pathological, incurable, hospitalized cases. I remember an interesting case that I had read with Kent of rheumatic heart disease, where he went into the house of the patient, and the patient was just throwing off his bedclothes, and he gave that patient lacases, okay, just on the basis that she was trying to just remove the cloth around her body. So similarly, you have to be very careful when you're going for a home visit, the patient is not speaking. You always have an opportunity to see around, look around. I remember I had read in Ken's lesser writing where he will say, I will sit days in the bedside of the patient to understand the color, the smell, the consistency of stool and urine. And then Dr. Kent will prescribe. So it's not just at the mental level that you have to observe, also at a physical level. What is it that you can observe, and that will be the entry point in the case? How is the nature of the tongue? How is the feature of the nose? I remember one case where there was simply coldness of the nose, and Dr. Shankaran had prescribed a remedy just on this basis that there was perspiration and coldness on the tip of the nose. Okay, so you have to observe your patient consistently, properly, and that's how you can start finding the remedies. Sometimes in the non-verbal communication, so many times students, they tell me, doctor, mera case, ma'am, what do I do? I have a case, and the patient is not talking only. Patient is not giving me any symptoms. What do I prescribe? That means you have not. It's not possible that you have seen a patient and then there is no symptoms at all. If you cannot, the problem with most of the homeopaths is either they are stuck too much at a mind level or they are stuck too much at a physical level. And at the end, either they have too much of irrelevant data or too little of any data. So the issue here is in the skill of how do you get to the remedy. Unless and until you master the skill of getting to the remedy and know how you can trace the totality, it will be difficult for you to move ahead. Okay, another very important aspect of case taking is how is the patient interaction with you. How is the behavior of the patient with you? How do you feel? Do you have to be very sensitive with him? Is he very clingy to you? Is he very independent of you? Is he asking for a guidance? Is he suspicious of you? Is he trusting you? Does he look down upon you? How did this whole conversation make you feel? At the end of every case taking, I make sure that I ask myself, how did I feel in presence of this patient? Was I in awe of this patient? Was I feeling sorry for that patient? Was I feeling threatened by this patient? Was I feeling, oh, I don't want to take this case? What was my whole inner being talking about this patient? What was the mannerism of his speech? Was he very structured in the mannerism of his speech, or was he jumping from one place to another? What was the key to this patient's interaction with me? I believe in your case taking, wherever you're doing your case taking, maybe in a piece of paper or on your desk, on your laptops, I think make a column where you can have a rough writing down of your observation, plain observation, nothing else. Okay, this will help you to build. So what normally we do is, as and when the patient is talking, ये pulsatile होना चाहिए, oh this could be lachesis, and I think this line could be hyosamines, and this line could be this, and at the end you don't have a remedy. You have this could be and should be and would be, but you do not have the remedy, because from very beginning you are focused on remedy. You are not focused on understanding the patient. Unless and until you change this focus, you will not be there at the remedy. And it's not just when your patient is a new case. I think this case taking happens at every follow up. People, my colleagues who practice with me, they often make fun of me ke Dr. Sadaf ko to follow up mein bhi bahut time lagta hai. Yes, because it is important. There was a joke that Dr. Sarkar cracked. It's like, remedy to de di, ab aage kya karna hai? You give the first remedy, what next? So that next problem will be solved only if you do justice in your follow-up. Robert, Kent, they have spoken about how your follow up should be. How do you understand the remedy reaction? Kent has given us 12 observation. Robert has given different reactions to the cases, to the patient that patient can come up with. Now, how will you understand if you do not spend time with your patient? If you don't understand what is happening, is the case working? Is the remedy started to act? Is there a stop action? What Burnett writes, start and stop action. Okay, you need to understand what is the starting action of the remedy, what point does the remedy stops to act, and then you can select whether you have to repeat the dose, whether you don't have to repeat the dose, whether you want to change the remedy at all, whether you want to give an acute, follow it up with the remedy that you have already given, or you need a remedy that will remove the block. That's how you take your case step by step. Okay. So I'll just take 5-minute pause from the presentation and come to you all just to ask if everybody is getting a hang on what I'm speaking. Okay. Just very quickly in the chat box, put yes if you're understanding my pace is okay. In the chat box, please, very quickly.
Ma'am, there is one query.
Query will take at the end, but okay. Is it
Someone
written down
wanted to
query?
speak.
Okay,
Someone
somebody
wants to
wanted to
speak.
speak. Okay, you can just allow them to speak. Hello, who wanted to speak?
Someone named Durga. Hi, Durga. If you're listening, you can speak now.
Okay, till then, rest of you all quickly in the chat box put yes, you're following. Is the pace okay? Whatever it is, very quickly put it in. So that I know you all are with me. Okay. So I take it that everybody's following.
One more person, Durga. Hi, Durga. You want to speak? You can speak now.
I think it was by mistake, or I don't know. Okay. So I take it that everybody's understanding and I'll go back to my presentation. Okay. So let me explain this point of view through okay. Through a case. A female patient of 53 years of age, married, came to me with uterine fibroids, ovarian cyst, renal calculus in both the kidneys with developed hydronephrosis. She had already went in for surgery twice, but there was a repeated episode of calculus. Hence, she decided that she doesn't want to do any kind of surgeries and wants to start homeopathic treatment. Okay, I'll give you a little bit background about this female. She belongs to a very traditional family staying in one of the villages in India, very conservative, and she has come for me for the treatment. Okay, and as the case flows, I'll tell you what happens. So she came to me and I asked her, what is happening? So she says, there's a recurrent stone that I have, and that's really taken a toll on my health. because already I have underwent 2 surgeries and I cannot afford one more surgery. I think it has badly affected my health because of, I don't know whether it is because of the renal pain or what, but she has this constant back pain in the lower side. And she says, if I sit, I really have to take support. I stand up like this. I have to stand up like this very slowly. If I'm lying down, I cannot just get up. Okay, lying down on back or on the side is very difficult. And there's constant tightness of the abdomen, which comes immediately after she eats, which also causes difficulty in breathing. Okay, I said, describe this tightness. Can you just explain me what exactly do you mean by tightness? So this is what I do in my case taking, is when a person has given me a symptom which is very evident and which comes like very spontaneously, especially the sensation. Okay, I need to understand what that sensation is. Okay, is it a sensation? Is it a kind of a character of a pain with certain modality? How do I use this word? Guess how do I use it? See, like it's there most of the time. Like जब मेरे periods भी आते हैं, when I have my menses also, I have this back pain. See, right now I was sitting a long time in your waiting room, and now I'm sitting with you. I started to feel this tightness. It's as if there is a band and somebody's pulling, like खींचता hai. In Hindi, she says खींचता hai, pulling or drawing kind of a pain is there. So this also happens in my chest when I feel very scared. There's a drawing pain, there's this tightness I feel. So go ahead, describe more. So she says, see, I remember few years back, my son was very small. My younger son was there, and it was 2.5 years back. I was very scared to be in my own house. मुझे बहुत घबराहट is anxiety plus restlessness. Often Indian women, they use this word घबराहट हो रही है, ठीक है? So there is this anxiety. For those who don't understand Hindi, it's a kind of anxiety with physical restlessness. She says, I will feel that I shouldn't be in the house. I feel like I just need to go out. My whole chest was tight. मेरी पूरी छाती जाम लग रही थी. Okay, it was full tight. I was having this pulling pain, drawing pain in my chest. This tightness was there. I used to feel as if somebody is just there behind me. There is a shadow. If I'm sleeping, I will feel there is something black just close to me. I will be very scared, and then immediately I will feel this tightness, as if there's a load, as if there is a band, as if something is pulling. So describe this pulling. It was just a fear, as if something is just going to happen. क्या होने वाला है, क्यों होने वाला है, मेरे को नहीं मालूम. But I was in a constant fear. I don't know what is going to happen, where and when, but I was in this constant fear. I said, what will be opposite of it? There's no load, no pulling. I will be nice. It will be light. Okay. So now when I'm sitting here, I can still feel that tightness. पूरे muscle कोई, मेरे पूरे muscles कोई खींच रहा है. There is a drawing kind of a pain that I feel in my lower back. So fine. Tell me more. She says, past history, I was all well. But then lately, what happened 3 to 4 years back, I had recurrent cyst, ovarian cyst, then stone, then uske operation, then I underwent surgery, for a long. But it kept on repeating. Then I had appendicitis attack. I went and did surgery, appendicectomy, and I feel this something or the other is happening to me, and I don't feel well at all. मैं आप डॉक्टर लोगों के चंगुल में फंस गई हूँ. पहले तो मैं डॉक्टर के पास जाती नहीं थी, अब डॉक्टर मेरे से छूटते नहीं है. So earlier I used to not go to doctors. Now I cannot do without doctors. It's as if I'm falling sick very rapidly. I have become very, very weak. So fine, describe this weakness. So she just went on saying all of this again and again and again. I said, fine. So now what I'm doing here, okay, so I have taken the 2 parts of the case taking. Number 1 is the chief complaint. When I asked more about it, she also gave me very spontaneously a past history. Okay, so I'm telling you my thought process over here. So what in this whole is very important for me. Number one is the physical symptom that the patient gave me, the relation of mind and body that she gave me, and how did the disease progress to her. Okay, what kind of pathology it is creating and how it is creating. And interestingly, when the patient is describing about the pathology, she's also talking about how does that makes her feel. So I'm now just going to note down the important points. Okay, clear till this point? Everyone, very quickly in the chat box, please very quickly put yes or no so that I can proceed. I'm taking this break because I don't want to go ahead, and because as I show the presentation, I cannot see a chat box. So right now, very quickly till this point, I hope you all are getting the hang of the case. Quickly put yes or no.
Hi viewers, please put yes or no. Are you following, ma'am? Till now?
Okay, there's no answer. I'll just take it that you all are following. Any questions, anyone? Okay, so I got one yes. सब सो गए क्या? नींद आ रही है सबको? आफ्टरनून टाइम है, इवनिंग हो गया है, जागो मोहन प्यारे. Okay, okay, so I'm not wasting my time. I'm going back to the case.
Yes, ma'am.
If
Continue.
any, yeah, if anybody has now any doubts, please keep it to the end of the lecture. Okay. Aditi, remind me when we are close to the end point. Okay, क्योंकि मैं बोलने लग जाऊंगी, I'll forget.
Okay, ma'am.
Okay, so this was the past history. Okay, now while she was also talking, I had a certain observation. The observation was there was a lot of moles around her neck, around her hands, cheeks. There were some warts, and there was a very distinct way of her talking. Okay, and so that when she was describing this whole event where she was scared, suddenly she will lower her voice and she'll be like, she'll just talk like this. And I'll be like, hey, what are you talking? Just increase your voice. Suddenly she will go into a mode which was very, like, very quiet and very nice, very slow, very steady. She will answer. I said, this is an interesting thing that she's doing. Like, and she was very careful, like, so like in my clinic, we have a camera. We used to keep a camera before. So at other song, we used to keep a camera next to us. So looking at that camera, she was very this. So what I did was I closed the camera. I called the IT department and I said, okay, take this camera out of the room. She was very conscious when the camera was there. And the camera was normally there in case of live cases. We had kept it, but then I asked the IT people to come in and take the camera out, and then she was a little bit comfortable. But every time there was the slightest noise, slightest footstep, she will go like, okay, she'll be quiet, she'll stop, she will halt. Okay, and she was very conscious while she was speaking. And after every line, she will say, Baba kisko bolna nahi, huh? So after everything, she will say, please don't tell it to anyone, huh? Make sure, nobody should come to know. So she was very conscious about the fact that she's giving me a lot of details. Okay, for a second I also thought maybe because we belong to same hometown, she's from my native place, so maybe she's so conscious. But this pattern she confirmed even in her follow-ups and in when she describes more about herself. But at this moment, while she's talking, while she's doing, very randomly I'm just noting all these things down, okay, that this is happening. The next I asked her was, tell me about you a little bit. She says she's very sensitive. She gets easily affected with somebody around. especially if somebody is not well, some mishap happens, some accident, somebody fighting, whether the fight she's involved or she's not involved, maybe it's neighbors who are fighting, maybe it's some family members who are fighting, it really affects her. Very easily offended when someone talks behind her back. She's extremely sensitive to criticism, sensitive about what people are going to talk about her, and most importantly, she gets extremely annoyed when somebody will inquire about her health. I said, what's the problem in that? No, 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 no. Why should they ask about my health? I don't like it. Even you don't tell anybody, huh? You don't tell your relatives that I came to you. I said, why? No, 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 please. I don't want people to know that I am sick. Whatever sickness I have, I know it's going to be managed. Why should people know everything about me? I don't like it. You know, whatever it is, even at home, whether there is some fight or there's some up and down, I never let anybody understand. In my family, if there is little fight or something, I'll make sure the voice is not raised. I'll make sure that nothing goes outside the four walls of my house. It has to be within the four walls. It's not good that people come to know about your condition. My suffering is my suffering. Why should people come to know? I always, whenever I have to go for any funerals, weddings, or anything in the village, I'm always well dressed. Nobody will look at me and say that this person is sick. I'm always well dressed and look good so that nobody can pinpoint that I'm not well. Okay. So this was more or less the case. So at this point, there are two, three, four. Like for y'all, I've just summarized the case, but the whole totality was right there in front of me. Okay. What is the most important thing for this patient? Who is the patient in front of you? I have my observation, I have her life space situations, I have her disease. I have a whole complete picture in front of me. Without any doubt, I know what has to be given. Can anybody, Aditi, now we can unmute the students. Can anyone unmute yourself and at least tell me what are you thinking about the pain? I'm not expecting you the remedy, but at least what do you think will be the analysis of the case? Very quickly, I'm just giving you 2 minutes. Okay, if nobody answers, I'll go back and show the presentation. Please raise your hands if you want to speak. If not, I'll just go ahead and explain. If you don't want to speak, put it in the chat box what you're thinking.
Any suggestions of the viewers?
Hiding nature. Okay. What else? Anyone else? Anything? What is the most important peculiarity in this case? How will you define, or which symptoms in this case will you take that nobody can conflict with? In every case, when you sit with analysis, okay, it's very important that what is the main thing that is very important for this patient. Hiding a weakness, sensitive to criticism, image consciousness. Okay. What else? Okay, I'm joining. Hello. Yeah, I'm back. Sorry, my mistake. Some wrong button I pressed, and
So
yeah.
there were some answers to it. Hiding nature,
Yes, yes.
hiding the weakness, sensitive to criticism. The person is image conscious, pretentious nature of the patient, secretive.
Okay. So this is all there. I agreed. Okay. So this is a part of it. Okay. Now I will tell you my approach, what I did in this case. Number one, I wanted to secretive, hiding nature. This will all be the mind symptom. Okay. And that I will prefer taking it towards the end to begin with. First and foremost, let me understand her chief complaint. Okay, the pain that she spoke about, and I'm going to see first in my repertory if I can find the symptom which exactly corresponds to what the patient is saying. Okay, then I will want to understand how can I use my observation about this patient. Okay, thirdly, whatever from her life space situation I have got, that will be the confirmation for my rubrics. Okay, that's my thought process. So what I did was I took following symptoms first: back pain, standing erect, almost impossible after sitting. And I've repertorized everything in Kent Material America. Back pain, drawing pain, sitting while. Back pain, prolonged sitting while. Okay, these are the rubrics that first I will take. Then what I will do is, then I will go to the basic observations that I had seen. Okay, like she will answer very slowly. Okay, very slowly, very secretively. Okay, and then this delusion that she spoke about, as if somebody is looking at her. Okay, when I take all these symptoms and I'll then repertorize the symptoms. After repertorizing, I will analyze in my head, okay, as to what is the basic sensitivity of the patient, what is the pace of this patient, what is the pace of the pathology, and where do I think this case is with respect to the miasm. Okay, and then when I can get all three of things together, I will prescribe. Okay, so now what is the miasm? Okay, number one, what kind of pathology we see? We see a pathology that is recurring. And what is the recurrence about? The recurrence is in the form of fibroid, cyst, stone. Okay, so there is swelling, there's inflammation. Okay, and most of it, the pelvic organs are involved. Second most important, person is very anxious about what? Anxious that people will come to know about my weakness, and hence what she does is she avoids all those things where the weakness will be out. She avoids talking about her complaints, she avoids any kind of fight. She's very sensitive to what people will say. Okay, so I know the miasm is completely psychotic. Okay, so now when I take my repertorization sheet and this understanding, okay, I get following remedy. Okay, so Thuja comes very straight, and we know Thuja belongs to conifer family, where the main delusion is that they are very weak, their body is getting weaker, and there's a lot of fixed ideas. Like now, nobody can break those ideas. And then her warts on face, the moles all over her body, all the outgrowths, psychotic miasm. I've given her Thuja. I gave her Thuja 1 dose, waited and watched. After follow-up in month of 2014, gastric trouble reduced, tightness of abdomen less, there was no tightness or jammed feeling. LMP 23rd October 2014, first 2 days less pain, but then there was a good amount of bleeding, there was staining. She had some pain for which I had given her SL and she was better after that. Back pain due to sitting long in traveling. Again, she had taken SL, she was better. Okay. Dreams, no major dreams, no frightful dream, more energetic, more fresh. Next follow up. March 2015, she had a very bad acute. In that acute, she had a lot of bleeding. Bleeding was, you can see on 6th Feb, she had a bleeding, then it stopped. The 9th Feb, she had bleeding, and again it stopped, and it continued. 27th, there was some spot, and then it completely went away. Then 1st March, again, she got menses. Okay, so pain during menses in abdomen and back, pain in back with heaviness. Again, the same sitting aggravation was there. Urine, thirst, appetite, everything was normal. So what I did was just took the acute totality, and in the acute totality, again Thuja was covered. So I gave Thuja 1 m repeatedly in plus potency till next menses. I didn't change the remedy, and I said no sooner you get your period, stop your medicine. Okay. Next follow up. Acidity better, pain better, menses was expected, but I have not got any menses. Pain near uterine region is not there. Back pain is not there. SL. In April 2015 again. So sorry, this was a repeat. This July 2015, no major problems with menses. 24th May she got. Then she got on 16th June. Urine was normal. No pains. No other complaint. No gaseous distension. No pain in back. April 2016, no major health issues. Menses have stopped altogether. Just some mild cold, cough, body pain, SL. No other medicine was given in April 2016. Feb 2017 also, no major illness. Cosmos. This is her USG 6 months before she started the treatment. Renal calculus, right and left side, both the kidneys 3 to 4 mm. Bulky uterus, 101 cross 56 to 59 mm. Fibroid 70 by 2 fibroids, 17 by 24, 18 by 20. Cyst in left ovary 36 by 51 mm in size. Total hysterectomy was indicated by gynecologist, but she didn't want to go in for that. She started in 2015 again when we repeated SQ. 2016, the size of the uterus, the bulkiness of the uterus reduced. Endometrial thickness came to normal. Fibroid size reduced, but it was still there. Cyst size again reduced. In 2017, when she repeated the scan, there was no calculus in both the kidneys. Uteri size, endometrial thickening normal, ovaries normal, no major abnormality was detected. The allopathic doctor herself said that it was amazing that how her scans have changed. Okay, so that was the case. Okay, this was the case. Was taking follow up. You also saw how I took in every follow up what was happening before a menses, during a menses, after a menses, because her main complaint was uterine fibroid and her back pain. Okay, any doubts? Any doubts with regards to case taking, analysis, follow up?
Dr. Sunita Chauhan is asking how plusing dose is given.
Okay, so I will come to that, Sunita, later. Let me first check if anybody is having any questions regarding the remedy. Okay, so I'll just go to Sunita's question. So Sunita, plussing method is it's mixing the dose in water, and you do +1 every time before you're giving to the patient. So instead of just repeating dry doses, so this is what I do in most of my cases if there is a severe acute, is instead of repeating very often dry doses, the same potency 1 m potency, I mixed it in half cup of water or say a bottle like this, and then the patient gives 10 upward stroke or succussions, okay, and takes it every 3 hourly, 2 hourly, based on the condition of the patient. How much importance should be given to physical symptoms? If it is characteristics, give it more importance than mental symptoms. I feel your physical symptoms, especially the physical characteristic symptoms, are the symptoms that will ground your prescriptions. In mental symptoms, there could be a lot of interpretations, okay? There could be a lot of subjectivity, but physical symptoms are more objectives. So first, analyze it on that basis, okay, and then use your mental, I do that, then use your mental symptom understanding for confirmation. But there are some cases where you don't have physical symptoms and what you have is a mental characteristics, then obviously you will have to give importance to that. So I won't say there is the rule, okay, like I said, there are different approaches. Every patient, as you're bringing individualization to a remedy, you have to individualize your approach in case taking, you have to individualize your case analysis, individualize the use of repertory. Like in this case, I have used Kent. There are some cases where I'll be only using Fata. There are some cases in which I'll be only using Bonninghausen, some complete, some no repertory at all. So every time, every case is different. So there should not be a ground rule कि यही होना चाहिए, इसके अलावा मैं काम नहीं करूँगा. So that, fixity, you will go into psychosis. So I don't believe in being fixed at one protocol or one way of the treatment. It can be anything. You have to give it its own space and let the picture come up. Clear, Muhammad Ilyas? Sunita, your doubts are clear? Please put yes or no in the chat box. Thank you. Thank you, Dr. Ahmed, for your good words. Anyone else? Any question? So, Bridget, your question is, you recently had a patient who couldn't answer. How does that makes you feel? He kept going back to telling me his life space situation. How do I interpret? He has the feeling about this family situation leading to depression, and I was able to elicit a score feeling at the very end. So sometimes the situation that the person is attracting itself is a symptom. Okay, that's one thing. Number two, the approach to this would be going into another direction at all, completely different direction, completely, like taking this person to an interest in hobbies, fearful situation, and then trying to understand. Sometimes the life space situation that might be actually bothering him, the person is not ready. And mostly, if I feel, if I'm stuck up going deeper into that situation, I just leave that part. I will then prescribe on the physical modalities or something which is very evident, rather than being stuck to that particular part. More, I can tell this if I see the patient, or if I'm personally witnessing the patient. But these three guidelines: number one, go to the physical modalities, go to some other uncompensated area where the patient could be like a dream, like a fear, like interest in hobbies, and then find out what the patient reveals to you, and that could be something very important. So if patient normally when he gives me a lot of stories after stories, I will stop that conversation. I'll take the patient to another situation or another area of his life and try to explore what the patient is basically feeling, or try to find characteristics at a physical level, past history, family history, or something else. Like very recently I had a case where this patient was, forget telling me how does that person feels in that story, he was not even ready to talk about what was his situation. So the very fact that he's not talking, wanting to talk, becomes a rubric for me. Reserved, okay, reserved displeasure, I took that as a rubric. And then I took all his pathological phy- uh, pathophysiological characteristics, physical characteristics, and then prescribed him the remedy. So that's how you can do, instead of going into something where you end up interpreting and making your own stories. I think doing this is more valid. Any other questions? So don't beat around. If the patient is not giving you something, I will suggest don't waste your time over there. Okay, or if something that patient is telling you again and again, then I think take a back seat, understand why this patient is talking again and again, and what is he trying to convey. Okay, how do you approach in skin cases? Okay, so like I said, number one, it depends what's the skin disease is. Okay, every skin disease will come up with its own protocol. So it's a very broad question, how do you deal with skin disease? But yes, again, try to elicit physical questions. Okay, physical questions are there. You can get, when is the itching more, what causes the itching, how is the patient better physically. Then if not at the physical, suppose if you have something like a vitiligo where you lack symptoms there, try to understand how did the vitiligo form, what is the cause, is it an emotional cause, is it a physical cause, and then take it from there. Always remember the basic rule: cause effect, and then your totality: location, concomitant, sensation, modality. If not anything, observation. Your question, Ilyas, is the same thing where we started. It's never that you do not have anything in your case. Okay, whether it's a skin illness, whether it is a mental illness, whether it is anything, the rule is the same. Start observing what your patient is doing. You do not, what you are looking at right now is a very mechanical system. मैं स्किन को कैसे अप्रोच करूं, ए लू पहले, बी लू पहले, सी लू? नो. Should I take A, should I take B? No. That's what I told you in my first part of my session itself, that whatever be the illness, remember one thing: start with without prejudice. Number two, observe, listen, correlate. Okay, observe, listen, correlate. Then there are more steps. Today we have just spoken about the skill of observation and listening. There are more steps to the case taking which you can learn, relearn. There are a lot of books that are available on case taking. Read. The first best book to read is your basic organon, where you are given every step. Hahnemann says, do not sit with a very cluttered paper. Keep a very nice plain paper in front of you and then start writing on it. Note it down word by word. Do not interrupt the patient. Take one symptom, get the whole totality around it clear, you're done. You do not have to waste time. Okay, if you're stuck with systems, if you're stuck with methodology, you'll be stuck. You will say, what do I do? Similar problem you'll have with arthritic cases, similar problem you'll have with convulsions cases. Every case in homeopathy is same. You just have to remember the key is case taking. That's it. I hope I have answered you, Ilyas. Have I answered you, Bridget and Ilyas? Please put in the chat box whether you have understood or not. Someone is unmuted? Somebody has unmuted?
Ma'am.
Huh.
Ma'am, it's 5:50.
Yes.
I mean,
So,
you told me to remind
yeah.
you.
So we are done. If there's no other question, no other answers.
If any queries, kindly put it in the chat box.
So if there is any query still, if you have and you are not able to write it, you can email to me or WhatsApp me. I'll just share you my email and WhatsApp details. So anytime you can just contact me on following number. We can help you out with the same.
I think, ma'am, no more queries
Yeah, I
right
think
now.
we will have more sessions in future on case taking. Aditi will inform you all as in when.
Yes, ma'am, we are definitely having another session on case taking. There is more to learn in case taking.
Yeah.
It's never the end. So, thank you, ma'am. This has been a very much informative and wonderful session, and thank you for sharing all the your cases and your experience and opinions. Also, vote of heartful thanks to ma'am and all the audience, and also Homoeopathic 360. So, ma'am, it's time to end the meeting for
Yes.
today.
Bye, everybody. Do
Thank you so
let
much.
us know what do you feel about the session. If you have any specific questions, please write to us, email it to us, so that we can address that in our upcoming sessions.
People can have a screenshot of the last slide. Thank you, ma'am.
Okay, dear.
Should we?
Bye.
Okay. Bye, ma'am. Thank you.
Bye.